everyone, today we are demonstrating the frontal female hairline design by 5A 5P principle. So in the 5A 5P principles, basically 5A stands for the 5 important areas which has to be taken care of. First is the frontal area, which is similar to the frontal tuft area in the males. Then is the frontotemporal recession area, which gives a typical M-shaped hairline or a masculine look. So this is the second important area, temporal area, frontotemporal recession. Then third is the temple area. So in some females where the temple line is temporal point is receded, this point has to be reconstructed. And then fourth area is the it's a narrow area between the temporal and the sideburn area, that is the infratemporal area, which has to be reconstructed if it is receded. And then fifth is the sideburn area, which again can be brought ahead to give a narrow look to the face. Now coming to the 5 important points which need to be marked before making the frontal hairline. So first we will just mark the mid-glabellar point, which is serves as a center point for symmetry marking. Now from the mid-glabellar point we mark the point C, which is the anterior-most point of the frontal hairline. This point is approximately around 5.5 to 6 centimeter above the mid-glabellar point. So this point, the height is not fixed. It depends on the facial features of the patient regarding the golden rule of 3. Now after point C we mark point A, which is the medial-most point of the frontal hairline. Now this point A has to be marked around less than 2 centimeter from the point C. If the distance is more than 2 centimeter, it may give a big high forehead length. So this point should preferably be within 2 centimeter of the frontal hair of the point C. So this is the reference point we have marked is the point A, which is the kind of the medial-most end of the frontal hairline. Then we mark the point B, which is the lateral end of the frontal hairline. So I take the help of the laser marker to get the reference point B. So this is the point B, which marks the lateral end of the frontal hairline. And then we mark the point C, which is the anterior-most point of the temporal hairline. So in her case, the temporal angles are quite well defined, so we do not need to reconstruct the temporal point. So the temporal points are already well defined. So we will just take them as the reference point. And then last is the S point, which marks the sideburns area. So in her case, that point is also defined. It lies on the border of the zygomatic arch. Now we will join these lines to get the full view of the frontal hairline. So now joining point C to A. So point C is the anterior-most point of the frontal hairline, or you can also say the widow's peak. So joining these 2 points with a slight convexity or a peak to the frontal hairline. And then the line from the point A to B, it can be flat or it can be slightly concave. It should never be convex, otherwise it will give a masculine look to the face. So this we are drawing the frontal hairline. Now from the point B to point T, the hairline, there are 3 ways described to mark the hairline. Either it can be an S-shaped hairline where the B and the T points are different, they are separate. So this gives a good definition to the T point and reduces the width of the forehead. And there is another way described to mark this point, that is the reverse S-shaped point, where the T point is quite close to the B point or almost they are overlapping. So this is the reverse S-shaped hairline, where the T point is quite close to the B point. So it gives a slight more height to the forehead. So this is the T point, this is the reverse S-shaped hairline, and then this joins the S point. So this we can see marks the female hairline for the frontal. So this is not any standardized. This is these are just a reference point and a reference guide for marking the frontal hairline as per the patient's requirement, as per